For Cardiosource Video News, I have the top 10 points from the new focused update of the 2012 Unstable Angina Non-STEMI guideline. Number one is, not surprisingly, that everybody should receive aspirin, and that should be given indefinitely. Dosing will come in just a second. Number two is that there are two new P2Y12 inhibitors that are now alternatives to clopidogrel. And this is actually the bulk of the new focused update of how to use these new agents. The number three point is that the P2Y12 inhibitor should be added to aspirin for up to 12 months. It goes on to specify that for patients with a drug-eluting stent, that should be at least 12 months, and you can consider treatment longer, although that is a tricky topic. Number four talks about prasugrel, and this is an agent that should be used in the cath lab that's used in patients with planned PCI who have come in with acute coronary syndromes. Number five, ticagrelor is approved for use in unstable angina non-STEMI in either medically managed or percutaneously managed patients. Number six is that prasugrel should not be used in this population in patients with a prior TIA or stroke where there's increased harm, and should be avoided also in patients who are over the age of 75 or have low body weight of less than 60 kilos. And there are some caveats to subgroups of those subgroups potentially. Number seven is that the dose of aspirin after angioplasty or stenting is recommended to be 81 milligrams in preference to higher maintenance doses. And this is in recognition of equal efficacy but less bleeding with that lower dose. Number eight is that if possible, ticagrelor and clopidogrel should be stopped 5 days before coronary bypass surgery, and prasugrel stopped 7 days prior to the procedure. Number nine is that warfarin, when used in conjunction with dual antiplatelet therapy, is known to increase the risk of bleeding, and as such, one should try and use low INR target of 2 to 2.5 with warfarin, in addition to low-dose aspirin and clopidogrel. And number 10 is that in patients who are hospitalized with unstable angina non-STEMI with diabetes, use of insulin regulation of diabetes should target glucose levels of less than 180 milligrams per deciliter, thus a broader target of not quite as intense reduction in glucose. So for the Cardiosource Video News, these are the top 10 points from the new focused update.